sorry to wake you, but I do just have a few quick checks that need to be carried out before I let you get back to some well-deserved rest and sleep. Okay. Don't worry, you don't need to move yourself or worry too much, just a few quick, simple checkups. And again, I do apologise for disturbing you in the night. My name's Lottie, and I'm going to be taking care of you for the next 20 minutes or so, just to check that everything is looking okay. So can I just confirm your full name? Good. And your date of birth? Okay, great. And any allergies? And do you want any medication? Okay, great. And how are you feeling right now? How comfortable are you on a scale of 1 to 10? So 1 being absolutely fine, 10 being extremely uncomfortable, in a lot of pain. Okay. And do you feel like you've got a fever? So any extreme chills, shivering, or alternatively feeling very hot? Okay. And have you been given any pain relief in the last 4 hours? Okay. Did that help? Good. And before I disturbed you, apologies again, how are you sleeping? Are you sleeping well? Good. Have you managed to go to the bathroom? Okay, good. Any other concerns or questions that you have for me before we take a look? Great. Okay, let me just put on my gloves. Going to feel your head first for any signs of a fever. Okay. Let's take your temperature quickly. I'm just going to ask that you open your mouth, and I'm going to pop the thermometer here under your tongue. Thank you. Okay, good. Right, let's listen to your heart now and your breathing. Just going to gently apply this to the chest, and I do apologise if it's a little cold for you. Just try and relax and breathe normally for me. Good. going to listen to your breathing, so just going down a little further on the chest. Again, just breathe normally for me. Good. And take a big deep breath in. That's it, fill those lungs. And exhale. Good. Okay, and again, big deep breath in for me. And exhale. Good. And can you cough? Good. Again, cough. Fantastic. Okay, let's record your blood pressure now. So just going to place this band around your arm. We're going to inflate that band to get a reading, and it will just apply light pressure, tightness around the arm, but no pain, I promise. Okay. Okay, so just wrap this around. To come up and have a closer look at the skin. I do just want to give the scar a little bit of a clean, okay, just to prevent any infection. So just have some sterilizing mist here. Going to gently dab onto the scar. Alright, now just going to feel the glands in your neck. Any swelling. Is that causing any pain or any discomfort? Good. Okay, now if you could open nice and wide for me. That's it. And say ah. Thank you. And again say ah. Thank you. Okay, can you swallow? Good. Is that causing any pain? Okay, good. Just open wide once more for me. That's it. Try and relax the tongue. Good. And once more, could you swallow? Great. Okay, now my darling, just to check your vitals and your responses, can you focus on me and just ignore the light? That's it, stay focused on me. Good. Okay, now I need to follow the light for me. Try and follow the light. Good. Focus, focus, focus. And follow the light. Focus, focus. Okay, good. And if I cover one eye, can you still follow that light? Good. And the other eye, following that light. Good job. Okay, just going to come down to your stomach now and have a feel there. When I apply that light pressure like that, is that causing you any pain or any discomfort? Good. And have you had any problems with going to the bathroom since your surgery? Okay. Feels fine, but it will be something that we monitor, okay? And if it does get worse, then please do let us know. Okay, we're looking at your hands now. Can you clench into a fist? Good. The other side. Good. And then finger to thumb. Good. All right then. So let me just take some notes. Spine, skull, need monitor bowel movements and digestion. Have you been experiencing any nausea? Okay. And what about any food? Have you had something to eat? Okay, yeah, I'd recommend having something light, maybe a slice of toast, some crackers. Definitely make sure that you're drinking enough water. I can see that you have been, which is great, but please continue to do so. Now, is there anything at all that you think would make yourself more comfortable? I can see that you'll choose some more pain relief, pain medication, if that's something that you think you'd need. Okay, that's fine. We can get something arranged. And in terms of your restlessness, would there be anything that I can do to help with that? Yes, perhaps I could read you a quick bedtime story before I leave you and go to my next patient, so we've still got some time. Okay, of course. Let me just finish my notes and be happy to do that for you. In terms of your next checkup, we'll give it another 4 hours and come back and repeat the process just to make sure that things haven't deteriorated and we're still looking nice and healthy. We can also check in and see if from your perspective anything's changed or if you've got any new concerns, okay? Right. Just take off my gloves and we can go ahead and read you a bedtime story to get you back to sleep. If you don't mind, but I'm not much of a storyteller, which is why I've asked ChatGPT for a calming bedtime story. So let's see what they've come up with. Once upon a time, in a peaceful forest, there was a little owl named Oliver. Every evening, as the sun dipped behind the tall trees, the forest would grow calm and quiet, filled with soft whispers of the wind. Oliver would sit on his favourite branch, gazing up at the glowing moon, feeling the gentle cool breeze. The world around him seemed to slow down, as if the night itself were taking a deep, deep breath. One evening, as Oliver sat quietly, a sleepy deer named Luna wandered by. Her soft hooves barely made a sound as she walked along the forest floor, her eyes half closed with sleepiness. "Good evening, Luna," Oliver said softly, his voice like the rustle of leaves. "Good evening, Oliver," Luna replied, her voice a soft murmur. "Isn't it beautiful tonight?" Oliver nodded. "The stars are shining extra bright, aren't they?" Luna smiled, then lay down on a bed of soft moss. "I think the stars are watching over us as we sleep." Oliver agreed, feeling the quiet comfort of the night around him. As he perched there, the moonlight bathed the forest in silver, and the leaves gently swayed, whispering lullabies. The air smelled of sweet flowers and fresh earth, and soon Oliver's eyes grew heavy. With a deep sigh, he closed his eyes, letting the peaceful sounds of the forest carry him to sleep. All around him, the night whispered its promise of safety, rest and dreams, reminding everyone that no matter what the day had brought, the night would always be a gentle, quiet friend. And with that, the forest fell into a peaceful slumber under the watchful eyes of the stars. I don't know about you, but that was super cute, and good job from ChatGPT. Anyway, my darling, I must get on, but I'll be back in a couple of hours to check on you again, and please do let me know in the meantime if you need anything.